Welcome and thanks for joining in this series of thematic discussions to share relevant proposals, innovative approaches, and best practices on critical topics related to drug demand and the problems arising from drug use as part of a process that will culminate in a final event called Barcelona Forum on Drugs from January 27 to 29, where the most significant contributions from the past 3 years will be presented. It's organized by the Association Proyecto Hombre, a non-governmental organization in Spain where I belong to, in collaboration with La Caixa Foundation. I am Oriol Esculies, International Commissioner, and I will be moderating the session. Big thanks to my colleagues organizing everything. Today, we will focus on a very timely and crucial fact: the new European Union drugs strategy. Its coordinator, Joe de Kock, will present it and answer questions from representatives of civil society and academia. We believe that sharing agreements and initiatives of this importance with key sectors is a necessary step forward toward achieving better results. And this webinar is our small contribution for that. The session should last 1 hour and will be recorded to be disseminated afterwards. Let's move to the first intervention. We asked her to say a few words of introduction, and she agreed. So we are so delighted to welcome Elena Álvarez, Deputy Director of the Government Delegation for the National Plan on Drugs from the Spanish Ministry of Health. She's responsible for all international relations. Elena, over to you.
Thank you. Good afternoon to everyone. Thank you to Proyecto Hombre for organizing this webinar and inviting me. It's an honor to share this space with all of you and the distinguished speakers. I work at the Government Delegation for the National Plan of Drugs, as Oriol mentioned, where we coordinate the national strategy on addiction in Spain, among other responsibilities. I have also participated in discussion in the EU drug strategy within the Horizontal Working Party on Drugs, HDG, which leads and manages the Council's works of drugs. At present, we are working within the HDG on the structure for the implementation of the EU drug strategy. As Joe de Kock will present the EU drug strategy in details, I will not go into contents. I have been asked to share a few general considerations in 3-4 minutes, which I have summarized in 5 key points. First, the EU faced challenges in health, security, and governance linked to drug use and trafficking. A comprehensive EU drug strategy is essential to coordinate responses, set priorities, and stay prepared. It should be a practical tool, and keeping drug policy high in the agenda ensures attention and resources. Second, the EU strategy must be comprehensive. Spain supports a balanced policy approach and actively advocates for it during the process, covering health, security, and social and well-being consideration. This vision was widely discussed while the strategy was being developed and is reflected in the final text. Third, the drafting process has been very useful. It included workshops at the HDG, exchange with member states, EU agencies such as the EU Drug Agency and Europol, and civil society, among others. This co-creation between the Council and the Commission helped member states share concern and understand each other's perspective, while civil society contributions were carefully considered and are reflected in the strategy, where civil society is mentioned around 20 times. I have the opportunity to discuss many aspects in detail with Joe, Angels, both present in today's session, and other colleagues from the Commission, and it was very productive. Fourth, it is crucial to involve all relevant actors in every stage, from design to developing and implementing the strategy. In Spain, we have had very positive experience in involving all stakeholders, including civil society. Fifth, the EU drug strategy matters not only at the European level, but also within member states. In Spain, for example, we are currently updating our national strategy on addiction, and the EU framework has been a key reference guiding this process. Its influence also extends beyond the EU, especially in international forums like the Commission of Narcotic Drugs, where we just returned from the last session in Vienna, and EU positions are followed closely. To conclude, let me remind you that we share a common goal: improving people's lives by promoting health, security, and well-being. Each of us has a role to play, whether in public institutions, academia, professional sector, civil society, or other domains. This EU strategy is only the starting point. The challenge is to turn into concrete, effective, and sustainable action, ensuring that health and security objectives are met. Finally, I thank everyone for their contribution and effort toward this shared goal. And I want to stress that it depends on each of us, collectively and individually, to make it reality. Thank you.
Well, thank you very much, Elena Álvarez from the government of Spain for your very clear introduction. Thank you very, very much. Now, we are very honored to introduce our keynote speaker, Joe de Kock, head of the Organized Crime, Drugs and Firearms Police Unit in DG Home Affairs and Migration of the European Commission. He has a Master of Science on Business Economics and Finance and did postgraduate studies on European politics and administration. He joined the European Commission 18 years ago, and in the last 6 years has covered a variety of home affairs topics from migration management over border security to internal security. Before I hand it over to him, I'd like to acknowledge his willingness to participate and answer questions live. I think that it says a lot about him, but most importantly, to drive the process for the approval of this new drug strategy. He will present it in around 20 minutes, followed by the questions conversational panel. Joe de Kock, the floor is yours.
Thank you, Oriol, and good afternoon to everyone also on my side. Thank you very much to Proyecto Hombre for inviting me today to present the EU drug strategy, which we proposed as a European Commission on the 4th of December last year. And I have to start by saying I'm humbled to present it because, as Elena also very much presented in her introduction, this has really been the result of a co-creation process together with the Council, where EU member states are represented, and us as a European Commission, through a series of dedicated workshops in the Horizontal Working Group on Drugs, with a lot of exchanges with different member states to understand the different realities that are out there inside the EU, with our agencies, the European Drug Agencies, the European Police Cooperation Agency, but also with civil society. We have, as a European Commission, a civil society forum on drugs expert group, and we took the occasion to really, in two intensive workshop sessions, also go through the previous strategy on what needs to change, what is the new reality. And that process of co-creation, of collaboration and preparing it is a fundamental one. It means also that we've been able to adopt a strategy that I think marks a clear signal of direction in front of a world drug situation, which is becoming more daunting across the world, I would say, but where the EU is responding with a strong and integrated framework with prevention, treatment, and security at its core. And I'm very happy that in the beginning of this month, in March, member states also endorsed this strategy in a ministerial meeting at EU level. And that meant that last week, and Elena mentioned that very clearly, we had the United Nations Commission on Narcotic Drugs in Vienna, we were able to go there with a very strong signal that the European Union and its member states are attached to a balanced approach on drug policies, grounded in a deep respect of fundamental rights. And I think that was a very strong message that we managed to deliver there, which would not have been possible without such a thorough preparation EU-wide. When preparing the strategy, we took with us some elements of the evaluation of the previous framework. We saw a lot of relevance in the previous strategic framework that was there. So this new EU drug strategy is stability and continuation, but also adapting to new realities. First, we saw a strategy needs to guide policy development at an EU level, but also very much at a national level within every member state. And it needs to inform our actions at international level, which it did last week very clearly, because it is giving us a voice with partners in private sector. It's giving me a platform to talk to you today, for instance, but also it gives a platform and a framework that allows national governments to go forward and speak internally with local administrations, with regional administrations, to build also upon at a national level to promote some of the very important projects and programs which are out there today. Secondly, a strategy needs to have an integrated vision. Drug policy is a complex issue, so it requires nuanced answers. This is not a very easy populist kind of policy field I am working in. And you heard my short introduction. I'm a business economist, so I work on internal security, but drug policy encompasses so much more. So in preparing a strategy, I will admit, for me, it was a learning experience as well, and discovering many different views and policy fields. But that is very much important in such a complex issue. Security needs to go hand in hand with health and social aspects of drug policy. And in a way, a strategy needs to create a bridge between those policies so that they don't operate each in isolation, but are mutually reinforcing. Third, flexibility. If we have a broad strategic framework, we need to be able to adapt to challenges. So we need to make a forward-looking approach to build tools to be able to respond to emerging challenges. And that is very much what we have been trying to do in building this strategy, and that's the basis we worked upon. We also looked upon the reality of the EU today, and how does the drug situation look. And I prepared a few slides for this presentation. Bear with me, and I hope you will be able to see them. But if you look at the EU drug situation, does this work?
Yes, perfectly.
Exactly. Great. So if you look at the EU drug situation, one of the things that popped out also analyzing is we see over time very much an increase in the potency of the different drugs, illicit drugs, which are out there within the EU, and the purity levels of these drugs. And that, of course, puts us into a challenging situation. It means that drugs are becoming more addictive, but they're not just becoming more addictive by accident. It means that drug trafficking by organized crime groups is intensifying. Criminals are out there to make their own living and their profit by trafficking drugs, and they are making them more addictive to be able to keep selling. It brings with it violence to local communities. It brings these potent drugs, which are also more dangerous to health. It brings environmental degradation, but it also poses, and this is the most important, serious health challenges. There is polysubstance use. There are new psychoactive substances. The EU Drugs Agency it's monitoring around 1,000 new psychoactive substances today, including some which are potent synthetic opioids. We are not in a situation like on the other side of the Atlantic when it comes to fentanyl, but we do see synthetic opioids also within Europe. Law enforcement is dismantling around 500 synthetic drug production labs every year, and precursor chemicals arriving into Europe, imported by organized crime, has reached record heights of 178 tons. So it shows that this drug trafficking by organized crime groups in Europe is intensifying. It also leads to that health challenge where you see that even if we manage to keep drug-related overdose deaths to a relatively low level in Europe compared to other parts of the world, drug overdoses caused 7,500 deaths inside Europe in 2023. And that's a number which is gradually and slightly increasing year after year. It is something where you think it might be stable, but if you look back 10 years ago, 15 years ago, we were at around 6,000. So there is quite a bit of an increase that is happening there. So that also means that the health challenges are out there. And of course, as we see that the consumption of drugs is changing, where, for instance, our EU drug agency reported just 2 weeks ago on the results of wastewater testing, and they saw that in several cities in Europe, if you compared between 2024 and 2025, ketamine traces went up with 40%, cocaine traces went up with 20%. We see that stimulant use is increasing inside the EU, which is also posing challenges to health professionals, because our treatment options need to adapt to increasing stimulant use, for instance. So this EU drug situation is not stable. It is changing. In the response of that, our EU drug strategy tries to put a comprehensive approach in reaction. And if I try to summarize it, I summarize it in 5 pillars, and we built a house together. A house which is, as I already said, it grounded on EU values, fundamental rights, and international law. I think it is an important message to keep extending, especially in such an international policy field as drug policy, that the fundamental rights and the people-centered approach on drug policy is a fundamental core value that we need to have across all of these pillars of a drug policy strategy. But then it gives us 5 pillars. The first pillar on enhancing preparedness, EU and national preparedness. 3 core pillars, I would say, on protecting public health, improving security, and addressing harms and risks related to drugs. And finally, a pillar of strengthening partnerships, both at an international level, but also within the EU partnerships. And these 5 pillars are then declined in what we say 10 strategic priorities. And I just want to take you quickly through the different strategic priorities. I don't want to spend a lot of time on it. We can go into more depth in the conversation afterwards. But that first priority is enhancing preparedness and the response. As I mentioned, we do see a change in the synthetic drugs, in the purity levels of drugs that are on the market, in the addictiveness value. So we do need to make sure that we are ready to respond to these new psychoactive substances, to identify which of them are dangerous and what are the right approaches to them. So we need better risk awareness, and monitoring is put forward with data collection, early warning systems, and foresight, because we also don't know what will come around the corner in 5, 10, 15 years. Fundamentally, we see a need to enhance response capacity. Response capacity means developing threat assessment, but also really national preparedness measures. I mentioned it already. We see that increase of stimulant use in Europe, and we know that treatment demand only comes 15 to 20 years after the first initial drug use, which means that if now today we see a big increase in drug use of stimulants, we know we need to prepare for, in 10, 15 years, have the treatment capacity for those people which end up looking for help. And that is important, that we are prepared and that we're able to respond to those kind of needs in our population. And finally, we need to bring research and innovation together on all pillars, on all elements, to see what is needed, what better treatment options are out there, what more effective ways of enhancing security are out there. It is really the first cornerstone pillar that we put out there today. If you look at the three main key pillars, I would say, in the middle of this strategy, we've changed the order compared to our previous drug strategy, because in all of the conversations preparing the strategy, the clear message that came out is drug policy is first and foremost a policy about protecting public health. This is about making sure people's well-being in Europe is taken care of, and that we make sure people can grow and prosper in a healthy way. if you look at that pillar, there are two strategic priorities we put forward there. A first one is on implementing evidence-based prevention and risk awareness. And here, this is very much in line with broader health policy, which is about cross-health and social policies being brought together, making sure there is a continuum of care, but also looking at various ways of prevention. Prevention means general health prevention, making sure people live healthy in a general way, but also having targeted environmental prevention in certain areas, and also specific prevention for vulnerable groups specifically. It needs to have links with mental health prevention. We do see that people who use drugs might also be in need of mental health support. Second element we look into and where we want to advise is effective awareness raising activities. How do we inform on public health in an effective way? And how do we disseminate evidence for those effective prevention activities? Second big priority in that pillar is, of course, about treatment, recovery, reintegration, where we're talking about making sure those voluntary treatment options are out there, integrated and adapted. And I know voluntary, we had a lot of discussions on, do we need to name that? For an EU environment, voluntary treatment is an evidence. But again, I told you in the beginning, we need this policy to this strategy also to project into the world, where attention to that kind of words like voluntary treatment do make a big difference in our discussions at an international level. And here very much we talk also about the continuum of care in the strategy. Treatment, recovery, reintegration needs to also be followed up with harm reduction measures for people who continue to take drugs and to use drugs. There is absolutely a continuum of care about improving public health of all people inside Europe. If you look at security, I mentioned at the beginning, we do see drug trafficking evolving and the risks and security threats of it intensifying in Europe. Cocaine remains the most trafficked drug to Europe. In 2023, seizures increased up to almost 420 tons. But also synthetic drugs are a growing challenge for the EU, with designer precursors being smuggled by organized crime. And so this third pillar really aims at improving security and protecting society from organized crime with three strategic priorities. When we talk about dismantling organized criminal groups, we talk about making sure law enforcement, judicial cooperation works well together, that there is smooth and good information exchange between customs authorities, which often intercept some of these drug trafficking shipments, and our law enforcement, which should go after the criminals that are trying to make a profit out of that. And of course, a follow the money approach to fight those criminal organizations is perhaps one of the most important, because we know that ultimately organized crime is trafficking drugs to try and make money. We need to make sure that crime does not pay and also react to that. Second main priority is disrupting drug trafficking routes, and where we see that in a way, the efforts by our law enforcement to stop drug trafficking from happening has meant that organized crime over the last years has been diversifying the way they traffic drugs into the EU. So we continue to act on maritime routes because a lot of our port workers have been threatened, have been put under pressure by organized crime to allow drug trafficking to happen through ports. We have invested a lot in that in the last few years to improve that situation. But today's situation means we also need to dedicate that kind of attention on trafficking through land, post and parcels, aviation, and also the online dimension, which is absolutely increasing. And finally, combating the production of synthetic drugs, which is happening a lot on EU territory with a lot of environmental impacts linked to them as well, I would have to say. That is then also leading me into that third pillar, addressing risks and harms, where, of course, when we talk about addressing risks and harms, we first and foremost have to talk about reducing individual drug-related harm, the harm of drug use to individuals, where, as I mentioned before, we want a continuum of care with our general health policies on prevention, on treatment, on social reintegration, where we absolutely see the evidence-based harm reduction interventions are not mainstreamed in Europe today. There is a very uneven access to harm reduction today in Europe. And we do believe that with this strategy, we wanted to underline the need to make that more accessible and to make sure that the evidence on effective harm reduction interventions becomes more widely available as well on that one. But secondly, and that's also very important, is we do see that drug trafficking does create broader social and environmental impacts. And also those harms need to be addressed to make sure that we have that integrated approach, which comes to supporting local communities very often, because while organized crime is acting internationally, the effects are very often felt at the most local of levels. Violence erupting of local drug dealer gangs trying to occupy territory and fighting with each other. How do we make sure there is more effective crime prevention happening? How do we make there is community policing happening to make sure young people do not enter into a life of organized crime, but also to make sure that broader communities feel their environment remains safe and they don't feel afraid to go out in the streets at night because there's drug traffickers and drug dealers on a corner. Linked with that at the same time, we need to look at harms at the local level, which are environmental harms. For instance, we know that the production of 1 kilogram of MDMA generates 58 kilograms of toxic waste. So this strategy really calls for protecting the environment from the waste generated by drug production laboratories to make sure that our social environment, our environment stays a healthy one for people to grow up in as well. And finally, and it's in the middle of there, it is of course also of one of addressing drug-related stigma and discrimination. To be effective, we need to have social policies where people who use drugs have their place and don't end up in the margins of society. That would be absolutely a failure for Europe if we would go into that kind of direction. The final big building block is building strong partnerships. And when we launched the EU drug strategy last week in the Commission on Narcotic Drugs in the UN, we did an event to present this strategy to the rest of the world, calling on them to partner up with the EU, because to be effective in tackling the world drug situation, we need strong international cooperation, whether that is for tackling organized crime, whether that is to really work on cooperation programs, on development-oriented drug policies, alternative developments, making sure that in those areas of the world where drugs are being produced, also there people have a viable economic life ahead of them that doesn't pull them into organized crime and drug production. We need to be building capacities in those partner countries.
Joe, a couple of minutes extra for
almost
you.
There. But we also need to work together on a very operational level. And the final strategic priority in that level is on enhancing EU coordination and strategic partnerships, where really we want to have that meaningful engagement with civil society. So, which is why I'm so excited to be with you today, but also scale up with private partners. I mentioned ports earlier, but there's other parts of our society and our economy which are being affected by drug trafficking, where we really need to cooperate. And finally, we co-created this strategy with member states, with agencies. We also need to work together when it comes to the implementation of that strategy. So if I conclude, I would say this new strategy has been a joint work to really look at an integrated forward-looking approach to the EU landscape, to respond to the challenges of the EU drug landscape, with on the one hand a stronger focus on this preparedness. We do see new risks emerging. We need to be prepared to respond to them. That very strong emphasis on health and prevention, but also very tangible actions on the security risks. And finally, a comprehensive harm reduction approach, where we're not only looking at individual harms, but also putting a strong emphasis on addressing social and environmental impact, and that implemented in partnership. This gives you a bit of a flavor of what our strategy is, and I'm trying to stop sharing my screen if all is well. I hope I've given you a flavor. I think Elena summarized it beautifully. I've given you a bit more, but very eager to respond to all of your questions.
Well, thank you very much, Joe the Cock. I can't interact with the audience now, so I cannot ask them, but I believe that they would probably say that you have presented in a very clear, easy to understand way in a very short time. So highly appreciated. Are you ready for the questions from the panelists? Okay, so great appreciation to the three interviewers today. The first question will be made by Ganna Dovbach, our greatly and committed chair of the European Union Civil Society Forum on Drugs, which is the expert group on drugs of the European Commission, and she's also the executive director of the Eurasian Harm Reduction Association based in Lithuania, although she's originally from Ukraine. Ganna, all yours.
It's very big honor to be here and to ask the question from our civil society forum. And actually, this year of co-creation of the strategy, that was the intense process. And thank you very much for a lot of opportunities for civil society to take part in developing the balanced strategy. But our question, it's more about the practical implementation of the health component or health response demand reduction in the strategy. Do you see some next steps and immediate steps and how it could look like in implementing it? Because drug problem is the very complex problem, and only security measures we all understand will not work. And we need EU coordination of the health response. How do you see it in a more effective way?
Thank you. Thank you for that question. Indeed, I think as I presented today, we have an EU drug strategy setting a balanced, comprehensive long-term framework, but that framework needs to be backed by targeted action. And I guess that's your question. How do we go from framework to action? We're doing that in a few ways. The first one is the strategy itself. The strategy itself, if you compare to previous strategy, contains a view EU actions to be taken either at an EU level or with our agencies with very concrete steps. And giving you an example, when it comes to the health and demand reduction elements, there is that EU prevention curriculum, for instance, being put forward, or I mentioned, and it was in my slide, promoting an EU harm reduction curriculum and developing and setting that up, disseminating best practices. So those are some very tangible, immediate steps that our EU drugs agency will be rolling out in the months and years to come. Some of them will go fast, some will be built gradually to already put at an EU level some elements of reply. Then, of course, there is a second level because targeted action is needed at an EU level, but also at a member state level. And I think, as Elena very clearly said in her introduction, a lot of the member states have taken this strategy to prepare national frameworks and national elements that build upon that. Health policy is to large degree member state competence. And of course, this is something where as an EU level, we need to be proportionate, we need to be proportional in respect to subsidiarity principle, which is a very expensive word for saying you need to act as government at the level where it makes most sense. For health policy, acting sometimes makes a lot of sense at the local level or at the national level. Certainly on health, I think there's not a single member state that wouldn't say that health isn't a prime national responsibility to care for the health of your citizens. So I have a lot of trust that this strategy is being implemented at national levels, but that of course doesn't mean that we leave them alone or that we don't try to accompany them at an EU level. And so that's a third element I would put forward. The strategy invited the Council, with the support of our agencies, with the support of the European Commission, to prepare an implementing framework. And also, if you look at the strategy, the previous strategy, it was accompanied at that time with an action plan that was comprehensive. We didn't go for a comprehensive action plan this year. As a Commission, it would not have been our place to propose something like this because there is so much national competence. But we're very committed to develop an implementation framework with meaningful indicators of how do we really measure that the situation is improving in member states. What are the actions we want to work on together? And that work has started in Council, and we will be working together with the member states on it.
Okay, thanks, Joe. Let's move on to the second question made by Matej Košir. He's the chair of the Vienna NGO Committee on Drugs, representing more than 450 organizations from all over the world. At the same time, he's the executive director of UTRIP Institute from Slovenia, long-standing career and expertise on substance use prevention. Please, Matej.
Thank you. It's an honor, and thank you for the invitation. And thanks also to Joe for a very summarized presentation of the very complicated, to some extent, European drug strategy. So this new strategy recognizes the importance of a balanced, health-oriented, and evidence-based approach. So from Commission perspective, what concrete mechanisms do you envisage to ensure meaningful and systematic civil society involvement in the implementation phase, which means beyond consultation towards real co-creation and shared responsibility, because we will also take our responsibility and commitment for the implementation of the strategy, of course. Thank you.
Thank you, Matej. That's a very hard question and a very easy one as well, because I see civil society role to keep challenging governments, to make sure that the policies which are developed are very much based in the realities that are there on the ground. But at the same time, you are an essential implementing partner for a lot of these policies. But the space for civil society is shrinking in parts of the European Union and certainly in the world. So that is not an easy space civil society is operating in, and we're fully aware of that. As a Commission, we try to do what we can within this strategy. I've mentioned it in the beginning. As a Commission, we have started preparing this with our own dedicated expert group that supports us basically in our policy making. It's a civil society forum on drugs, where for instance, Proyecto Hombre actually is one of the members of that expert group. And where really we have your input on the one hand into policy making, but not only into policy making. We have a regular conversation with the expert group. And for instance, when we do international dialogues with third countries, we always get a contribution from civil society on what is the reality in engaging with that international partner. What do you need to be mindful of? And we go also at very concrete elements where we make sure that we reimburse experts and we pay for their travels to be able to participate in the Commission on Narcotic Drugs at the United Nations, for instance, last week, or in council discussions for the preparation of that implementation framework, for instance. But there I still stay on policy making in a way, or international dialogues, which of course the European Commission is many things. A very operational organization we are not. We are Brussels based. We depend on how things are being implemented in member states. And there we work in this strategy with two ways. Firstly, the EU Drugs Agency, or agency really responsible for drug policy, has a new mandate, and in which civil society is given a bigger role. They are developing a consultation forum in which civil society organizations are included, with an online platform also for exchanging best practices. So a bigger role for civil society in how our EU Drugs Agency is monitoring the drug policy is a very important element, and providing policy advice to member states. Okay. And the final one is, of course, civil society operates within member states. And I think there the EU has adopted last year also a civil society strategy, really promoting and trying to make sure that space for civil society is maintained in all of our member states, because of some of the member states are actively involving civil society, but we know that that situation is different from one to the other. Very concretely, what we put as a strategy and a strategic symbol is, we mentioned in the strategy that nationally civil society's knowledge of trends and effective responses should be harnessed to shape and implement policies, and ensuring appropriate resource allocation for all drug services and fostering civil society involvement is crucial across all levels to support those efforts. So we are trying to put those signals out there, and we will, of course, in establishing that implementation framework, also be attentive to those elements as well. But I know a lot of member states are eager to work with civil society to make that happen.
Thanks, Joe. Professor Michal Miovský will make the third question. In 2017, he was elected the first ever, and he still is, president of the International Consortium of Universities for Drug Demand Reduction, more than 500 academic institutions. Head of the very renowned Department of Addictology, First Faculty of Medicine of the Charles University and General University Hospital of Prague, Czech Republic. Michal.
Thank you very much, Oriol, and thanks so much, Joe, for your presentation. For better understanding my first question, I need to explain the broader context because European member states have been using prevention standards for many years. The strategy perfectly emphasizes this perspective and points out the priority to follow this direction and follow the previous strategies. But it reflects the situation 15 years ago. Today's issue is implementation. For instance, from Phoenix European project, we already know that many member states are far from just promoting standards. Some states already have highly sophisticated national insurance systems and well-functioning national infrastructure, usually with strong university participation. It looks like we have a problem with how to use this expertise and outputs, how to adapt existing results and accommodate and compare different strategies used by particular countries, and how to exactly support standardization of this entire process and make these quality assurance systems and policy comparable and compatible in Europe. So, and directly to my question, how exactly, Joe, do you see the role of academic sphere in the process of implementing standards and adapting and establishing quality assurance systems in particular member states? I mean, can you imagine, for instance, the stronger and coordinating role by EUDA in this matter, creating some kind of university core network coordinated by EUDA or something like that?
I can be very short on this question, actually. Yes, and if you read the strategy on page 5, it says the EUDA will create a drug-related research database and a community of knowledge bringing together policymakers, scientists, civil society, and field experts to bridge critical knowledge gaps. So that's a very short answer. Yes, I'll take a bit more time. No, in preparing this strategy, the first version of it that we wrote, I mean, this isn't a public secret. These kind of strategies go through iterative writing processes and you consult different people to try to improve it. The first version we wrote had the words evidence-based and science-based or scientific more than 100 times in it. So I brought it to my political level and they said, look, this is so much evidence-based and science-based that you need to reduce the mention of those words. They're still there, not 100 times, but it is very clear that one of the things that was the EU cited at an international level to some of the other constituencies which are out there on the world is that we do try to build our policies on a base of scientific evidence. A lot of efforts are done there, which are treatment, but which are ineffective treatment measures. It's very interesting if you have the UNODC present its statistics. I recall in the preparation of the strategy, one of the conclusions we have, and that's a plea I also made in this presentation, is we need better treatment for stimulant use. This is something where more research is needed because we don't have all of the effective approaches to it yet today. Yet if you have a presentation of the UNODC, they will show you in the World Drug Report that in Southeast Asia, 40% of the treatment is on stimulant use. So when I asked them the question, but 40% of treatment on stimulant use, so in Southeast Asia, they have effective methods, the response was, well, maybe not. So we absolutely invest in this strategy on bringing research efforts to a higher level. That's a message. We at an EU level have security research through our own programs, and we hope that in the next spending cycle, we will be able to continue investing in health research and in security research, because that is a very important thing. But then, of course, that needs to happen also at the national level when national administrations are setting up their systems for them to be effective. What we do, as I mentioned, and that was a short answer, the EUDA is creating that community of knowledge to try to bring researchers in. The EUDA itself is a research institute. It's not only an agency, but it is a research center of excellence. And we want to make sure that they can really employ those researchers to be effective. What we are shifting there is indeed on implementation. Research in itself, the EUDA used to be the European Monitoring Center for Drugs and Drugs Addiction. It has been turned into an EU Drugs Agency. The signal we want to give with that is it is not only about monitoring and having that scientific information gathering, it is also science-based advice for what are the good policy measures and the implementing measures.
Okay, great. There are 3 more questions left and 10 minutes left, but I think we will make it. Let's try to be brief, the question and the answer. Ganna, second round.
Yes, my second question, naturally coming from a lot of human rights violations faced by people who use drugs and women who use drugs. And usually we are putting gender equality components and gender sensitive services in harm reduction package and legal support in harm reduction services. Could you mention and give a picture where in the strategy we see this human rights centered approaches? A part of being named in the preambula and being actually the key value, which is put as a background for the strategy.
I think I want to be very targeted. I think there's a few issues that we put forward in the strategy very clearly. The first one is it is in the preamble, and I think it is important for the international message that we give. When it comes to the European message, there's 2 elements I find very important. One is on treatment. Treatment access is unequal gender. If you look at the statistics of access to treatment for different gender groups, there are clearly still very big hurdles. And so this is an area that we pinpoint and flag in the strategy, that efforts are needed to make sure that easy access to treatment is there in a gender sensitive approach. The same, I would say, holds true when it comes to the harm reduction services. There again, we need to be very mindful that we make sure there is equal access, even if women LGBTIQ+ are a minority of drug users. If you look at their access to treatment, if you look at their access to harm reduction services, they are still underrepresented then. So drug use is a male problem in Europe, but it shouldn't be that only males then have access to those elements of tools. So those are things I would put out there, but it is in the chapter horizontally. Why? Because it is also relevant for chapters like security, I would say. I think when it comes to the security approach, we will need to be more firm against organized crime, but that has to happen in a very responsible way, where again, it is still people-centered and where this works together with the other pillars. So that is why we do have it in the chapeau as well.
Great. Matej?
Yeah, my second question was partly already answered in the first one, mentioning the collaboration also at the UN level at CND and bringing civil society organizations as a part of delegation as well. So the question is as follows: given the increasing need for policy coherence across EU institutions, member states and international fora such as the UN Commission on Narcotic Drugs, how does the Commission see the role of civil society networks in bridging these levels and helping translate strategic priorities into real-world impact? Thank you.
Yeah, I think in a way I somehow addressed part of that indeed in my first response. No, I think civil society, and I'll repeat myself, I think civil society brings a lot of awareness of the situation on the ground, operates at grassroots. It's something I did in my presentation. I mentioned that when organized crime doing this drug trafficking is international, the effects are felt local. The local is where a lot of our NGOs and our civil society is operating in. So that is a richness that you somehow need to encompass. And what the strategy talks about there is the importance of using the knowledge of people with lived experience into your policy making. bringing that at an international level is a very tricky thing, because when you talk international, you talk state to state, and that is a reality. We do go there with an EU voice adopted in a council, whereas civil society role is also to be that agitator that goes into the edges, that creates some discomfort into a policymaker. It is your role in a way to do that, and it's healthy in a social and in a democratic space to have that. So how do you balance that? We try to do that by, for instance, funding indeed the participation of some members of civil society into a UN forum, because the beauty of that UN forum is that it's so diverse that there is that space for civil society. And what we want to do is also make sure that in setting the implementation framework at an EU level and within our member states, we make sure that space remains foreseen. And there, indeed, our civil society strategy I refer to is looking at tools of how do we make sure that space of civil society is maintained at the European level as well.
Thank you, Michal. Last question.
Thank you, Oriol. My last question is maybe a little bit sensitive. There is robust evidence supporting harm reduction interventions, and European countries are using quality standards and developing quality assurance system, etc. Other academic institutions provided dozens of reports and papers proving that harm reduction is effective and safe. That's clear. And harm reduction became a fundamental part of European strategy and one of the pillars. Despite all these facts, harm reduction in many European countries depends on special grant system, and harm reduction interventions are not equal and adequately integrated into the national health and social policies, nor do they have a stable financial support nor an equal position to treatment and rehabilitation. By the way, we have a very interesting economic analysis from Central Europe shows how fragile this position is. So, and my question is, what role do universities and academic institutions play in further process? I mean, we conducted tests, evaluations, and analysis. Is there anything else in your eyes, Joe, how our academic network can contribute and support this part of strategy in this period?
It's we put forward harm reduction. I mentioned it in the presentation. The individual drug-related harm reduction is a strategic priority. So the message we do send is we need to increase the availability and coverage of those evidence-based harm and risk reduction interventions that you mentioned. It's a full page that we try to explain on why that is important in this strategy. We've seen in the evaluation that there is uneven implementation of this inside the European Union. Because this was also in the previous strategy. It is uneven across member states, but I would say it's also uneven within member states. Not every area in every member state has that same access. Often those kind of services are concentrated into a few large cities for some of our member states. At the same time, I think that you've done the work that you can do as academia and that you need to continue doing. And that we try to leverage in now building up this EU harm reduction curriculum I presented about. I think our goal is to bring all of those best practices available and to build them into a really easy curriculum that policymakers can use. But then, of course, we need to be mindful of the democratic roles and responsibilities of each, where policymakers have a responsibility, and in health policy, it is up to national policymakers to develop the health policies that make sense in their national environment, in the democratic sphere in which they operate, based on the constituency. You will not hear me advocating for a harmonized approach on this across all member states. We need to be mindful of local realities and of local situations, and that's a prerogative in every member state. Of course, we are clearly saying we see the added value in it and we encourage you to increase it. But it needs to be done in a way that is mindful of national realities, and any new measure, and I can apply that to how I learn my kids to do new things as well. Initially, there is resistance, then there is some curiosity, and it takes a lot of patience and explaining and showing very often for things to grow and to be nurtured. And there, the beauty of our European system is that it is incredibly strong. And Elena mentioned in her introduction the Horizontal Working Party on Drugs. I assist to a lot of meetings where there is an exchange of best practices and where some of our member states who are at the frontier of these kind of things are really explaining how their measures work. I was last year in a visit of a drug consumption room with representatives of 27 member states who join, who see how that works in practice. So that is really the beauty of, and it links maybe with my previous answer, the importance for academia, the importance for civil society is to maintain that space, to keep that broad enough so that policymakers are confronted with those examples, with those strong best practices, so that it can be nurtured and grow.
Okay, excellent. So, Joe, we are about to end the session, but would you like to tell us anything? Or to demand or ask us anything? Mind that all participants are not only from the EU, but also from other world countries. So, this is your last chance to tell us any final remark.
I feel very humble. I would almost say I need to share my final remark with Elena, because as I would say, drug strategy is a joint effort. My final remark would be drug strategy is a joint effort to implement it and to make it a reality. In Europe, we try to put a very clear message out there that you need a balanced, comprehensive approach. The drug situation is a complex one, so it requires those nuanced answers. And it's each and every one of us that has a responsibility to play a part in that and make sure that that balanced approach is also very much then turning into a reality on the ground. You can count on the European Commission, you can count on our member states and council to also build that and drive that forward as we develop an implementation framework for making that strategy a reality. But it's clear, also mindful of my previous response, that we will need the academia, we will need the civil society's help in all of this.
Okay, thank you so much. We will share the recording of this session to all registrants, but also through many networks, so many further people will have the chance to watch this pertinent session. I want to thank Joe the Cook for your engagement. Thank you very much. Also, Elena Álvarez from the Governor of Spain. It's very meaningful, her participation here today, and also especially the three panelists questioning. Michal, Matej, and Ganna, and all of you, all participants, my colleagues, organizing this webinar over the last 2 months. So also your colleagues, Joe, Angels, etc., for the support we have received. We will inform by email. We will share the recording to all of you, but also informing on the upcoming thematic discussions, more following. So thank you very much. Have a nice afternoon and wish you a good day.